Welcome to the Cambridge Healthy Smiles program, operated under the Cambridge Public Health Department. Our mission is to improve oral health and increase access to dental care for pregnant women in our Cambridge community. Hi, Sharon. Good to see you. How have you been feeling?
I'm feeling well. I'm here to treat my cavity. Is it okay to have dental treatments now that I'm pregnant?
That's a great question. Research has shown that routine dental cleanings and x-rays are safe during pregnancy, as long as proper shielding is used. Local anesthesia is also safe if needed. Emergency dental treatments such as extractions, root canals, and restorations or fillings are safe to undergo during pregnancy. However, it's best to avoid major dental work in the first trimester if possible. If you delay necessary treatments until after your pregnancy, you might face more complex problems later on, which can be harder to address.
Thank you. I feel relieved, but I have been reading about how pregnancy can affect my oral health, and it makes me a bit worried.
It's great that you're proactive about this. During pregnancy, hormonal changes can increase your risk of gum disease, cavities, and other dental issues. Poor oral health is even linked to complications like preterm birth and low birth weight. But don't worry, we're here to help you maintain a healthy smile throughout your pregnancy.
That sounds important. What steps should I take?
Let's start with the basics of proper oral hygiene. First, brushing your teeth is simple but so essential. You should brush twice a day with a soft bristle toothbrush and fluoride toothpaste. Let me demonstrate it to you. Brush for a full 2 minutes. Hold your toothbrush at a 45-degree angle to your gums and use gentle, circular motions to clean each tooth surface thoroughly. Clean all surfaces. Pay attention to the front, back, inside, outside, top, and bottom of each tooth. Don't forget your tongue. Gently brush your tongue to remove bacteria and freshen your breath.
That sounds manageable, but sometimes morning sickness makes it really hard to brush my teeth.
I understand. Here's what you can do if morning sickness makes brushing tough. Use a smaller toothbrush. It can help reduce gag reflex. Change your timing. Brush at a different time of day when you feel less nauseous. If vomiting from morning sickness, rinse with water after vomiting or a fluoride mouthwash to protect your teeth.
Those tips are helpful. What about flossing?
Flossing is just as important as brushing. Here's how you'll do it. Use about 18 inches of floss. Wrap most of it around both middle fingers, leaving about 1 to 2 inches to work with. Gently slide the floss between your teeth. Curve the floss. Form it into a C shape against one tooth and gently slide it up into your gum and down along the side of each tooth. Use a clean, fresh section of floss for each tooth. If your gag reflex is acting up, try using a flosser with a handle.
Thanks, Melina. I'll definitely try to follow these steps. And I understand now I do need to see the dentist regularly, even while pregnant.
Absolutely. Regular dental visits are safe during pregnancy and important for maintaining your oral health. Your dentist and dental hygienist can spot any issues early and help ensure the health of your teeth and gums. For more information or to become part of our growing community of the Cambridge Healthy Smiles, we invite you to visit our website where you'll find valuable learning materials and referral information. We're here to support you, so feel free to reach out to us directly at healthysmiles@cambridgepublichealth.org. Together, let's create lasting change, one smile at a time.